I just wanted to walk you through a proposed social impact bond that's being considered right now. This is to improve childhood outcomes in South Carolina. I wanted to get a Georgia example, but this is as close as I could get. So childhood outcomes in South Carolina are not good. South Carolina ranks 45th in overall child well-being, and they're consistently behind in all four of these dimensions: economic well-being, health, education, and family and community. So the SIB proposal is to bring in nurse-family partnership, which targets low-income, first-time mothers and provides them with home visitation and follow-up visits from pregnancy through age 2. Home visitation programs have been shown, and they've actually done a number of studies on this, to reduce the number of premature babies and low birth weight babies, to improve child health and development, reduce child maltreatment, improve maternal self-sufficiency, and prepare children for kindergarten. What's interesting and makes this a pay-for-success opportunity is that for every kid whose childhood is improved materially, that will save the state of South Carolina about $19,000 over the course of that child's first 18 years of life. Those savings accrue to different budget lines within the public budget, which is a significant challenge, and I don't want to minimize that, and something that we should talk about in the Q&A session. But as you can see, the bulk of those savings accrue to Medicaid, and the rest are spread fairly evenly between other public programs. So for every kid that you can lift out of you can improve their childhood outcome, you save the government $19,000. So this is a slide that I prepared just to illustrate how this transaction could actually work. This is a proposal by the Institute of Child Success, Institute for Child Success, excuse me, and they're proposing scaling up nurse family practitioners' involvement in South Carolina to the tune of 2,750 additional mothers entering into the system. The cost of that intervention, serving 2,750 new mothers, is about $21 million. But the savings that accrue to government, again, over those first 18 years of life, dwarf that. $52.6 million that accrues to government in terms of savings. Some money is set aside for an impact auditor and the intermediary. That's the third sector capital partner group, or the U.S., the Social Finance U.S. Intermediary that I talked about before. Even after those costs are taken into account, there is a net savings to government of $28.6 million. Just for illustration's sake, I split that down the middle and assume that half of that would be used to pay back investors. And of course, this is on top of the principal that would already be returned to investors. And the remaining 50% would be left to government as savings to taxpayers or money that can be reallocated to other programs.